Good morning. Good morning, everyone. Good morning. I know it's early for some and a little later in the morning for others, but I want to thank you for joining us, for starting your day with us. We are honored to be in your home and honored to have you in our homes as we begin this conversation with a really rich discussion and some of the sheroes and heroes that I honor who are doing work in the South to address HIV and AIDS. And again, I am so honored to be with you. My name is Shanell McGoy, and I am director at Gilead Sciences, where I oversee the Gilead Compass Initiative. Let me start by saying the day. I think that's always important during this time where the days seem like they turn into weeks and turn into months, and we're just rolling along. Today is Friday, August 21st, 2020, and this is the second day of the Southern HIV/AIDS Awareness Day. It's the second annual Southern HIV/AIDS Awareness Day. Yesterday, really the awareness day where we bring attention to what's happening around HIV and AIDS in the Southern US. And then today is solutions, where we talk about the solutions to address HIV in the South. I am joined by some phenomenal people, phenomenal, amazing folks. As I mentioned, they are my sheroes and heroes. So today's discussion and panel, the title is The Southern Solution, The Community Knows the Way, a conversation with the Gilead Compass Initiative partners. Let me tell you just a little bit about the Gilead Compass Initiative before we get started in our discussion. The Gilead Compass Initiative is an unprecedented 10-year, $100 million commitment in which we are working to address the HIV/AIDS epidemic in the Southern US by supporting local communities and supporting evidence-based solutions to meet the needs of people living with and impacted by HIV/AIDS in the Southern US. We know that the disparities of HIV really exist in the South. More than 50% of the new HIV diagnoses in the US are in the Southern US. And just a little less than half of the deaths in the US related to HIV and AIDS are in the South as well. But you know what? We have some solutions today. This distinguished panel are going to bring solutions to you. They're going to talk to you about the work they're doing here in the South to address HIV and AIDS. And so I really want us to focus and enter this with hope and a mindset of the community knows the way and has the solutions to address the epidemic in the Southern US. So with that, I am going to ask Marco to introduce himself, to tell us a little bit about the work you're doing, the organization you represent. And I think it's important as well, if you can share with us one thing that you're doing during this time to address your self-care. How are you leading yourself, your soul, your spirit, and staying hopeful during these difficult times?
Thank you so much, Shanell. Hi, everyone. My name is Marco Antonio Quiroga. I use he, him, el pronouns, and I'm here in Orlando, Florida. I am the director for the Contigo Fund, and I always start off by saying I am undocumented, unafraid, queer, and unashamed, and I think that's incredibly important, especially in these challenging times for marginalized communities, in particular for undocumented communities who have been at the crosshairs of hate and bigotry for so very long, through this, not only this administration, but through decades of xenophobia, that we really self-identify and we're able to own our identities and our power. I am the director for the Contigo Fund, and the Contigo Fund is a fund that rose out of the Pulse tragedy in Orlando, Florida in 2016. The Pulse shooting that specifically targeted LGBTQ communities of color, and we've been working in that recovery and movement, community building for the last 4 years. So we've been in that journey since then, and I am, and our community is not unlike so many other communities across the South who are experiencing so many disparities and crises. We had a unique crisis that we had to recover from, and so many more since that time. And so one thing that I'm doing to take care of myself during these times is being around chosen family. One of the things that we learned is that we need to be there to lean against one another, and being outdoors as much as possible, kayaking at the pool, just doing a barbecue with just like my family. Those are the things that are keeping me centered.
Thank you, Marco. Thank you. And next, let's hear from Linda Dixon. Linda Dixon in Mississippi. Can you introduce yourself? Tell us about your organization, your role, as well as what you're doing for self-care.
Good morning. Good morning, everyone. My name is Linda Dixon, and I'm the Health Law Director at the Mississippi Center for Justice in Jackson, Mississippi. The Mississippi, and my pronouns are she and hers. The Mississippi Center for Justice is a nonprofit public interest law firm. We are committed to advancing racial and economic justice, and we're supported and staffed by attorneys and other professionals. The center develops and pursues strategies to combat discrimination and poverty statewide. In addition to the Health Law Division, we work on consumer protection issues, housing, immigration, disaster recovery, and impact litigation. In the Health Law Division, I work on access to health care and public health benefits in HIV. The center focuses on HIV discrimination, employment, housing, and privacy rights. We work on stigma, HIV criminalization, and we do this through providing direct legal services, policy reform, outreach, and education. I have been doing self-care by taking long walks near water. I love the water, and just staying, in tune with myself and being able to help those in my immediate environment.
Now let's turn to Halenia. Halenia Cruz in Memphis, Tennessee. We want to thank you for joining us, representing Partnership to End AIDS Status. Good morning to you. Can you tell us a little bit your name, introduce yourself, tell us a little bit about your role in the organization that you're working in, as well as what you're doing for self-care.
Good morning. Thank you so much for having me. All the way from Memphis, Tennessee. Glad to be here with everybody. I'm Deputy Director at PE's Partnership in AIDS Status, an organization that started out as a small, just simply testing for HIV organization, and we have grown into holding 7 grants, and Compass being one of them. Compass is one of my favorite grants because we got to do a project that I couldn't wait to do, as far as kind of take our girls back to school, and now take our guys back to school as well, because we have a same gender loving men program now. We have grants all the way from HIV testing, Twister, which is an empowerment grant, FC grant, which is our harm reduction grant. We have Acceleration of Men, which is our Compass grant now we're doing. Our older Compass grant was focusing on transgender women. So we try to reach everybody in the underserved population, especially our LGBTQ person. We are a family at P, so we try to bring the community into our family. We don't look at people as numbers, as clients. We look at them as new family members. And that, I think, is something that has helped us to reach the community in the way that we have, because, family, we get out there and we have family reunions, and we get out in the community and bring everybody to the reunion. That's kind of how we work things at P. As far as self-care goes, it has been a journey for a transgender woman to find what she could do in Memphis, Tennessee to take care of herself. And I found that creating my own vacation spot in front of my place was going to be just that. I dug a koi pond that has turned into the hot spot here in Midtown. So I don't know if that's a good thing or a bad thing. Could have brought a lot of attention to myself that I don't need, but I end up doing it extremely well, better than I ever thought I would. And the whole city is just in awe about it. So that's what I've done for self-care to kind of get this pinkish color that we're trying to get out of the screen right now. So that. And work is self-care in so many aspects of when, even though it's hard sometimes, but when you get there and that person really needed you to be there that day, that really does make you feel good. So.
Thank you, Helen, for your introduction. And, I think it's important to recognize that for really all of us on this panel, that the self-care that we do for ourselves is also community care, right? We're also taking care, making sure that we're whole, and also providing opportunities for the community to heal and be cared for it as well. So when I come to Memphis, I'm gonna check out this koi pond. I think you sent me pictures of it, but it seems like the most serene and peaceful place to be.
Thank you.
You're welcome. Penny, how are you this morning?
I'm great, thank you. Good morning. Good morning. Thank you for the invite to the panel. I really appreciate that. My name is Penny DeNoble, and I am here in New Orleans. I am a queer woman who have been living with HIV for 34 years. I am co-ED at FrontLine Legal Services, and I've been with FrontLine since February 2019, and I became co-ED in January 2020 when the founding director retired. My fellow co-ED and I decided we'd like to initiate the co-ED style of leadership, and it works well for us as we complement on one another's leadership style and we build on one another's strengths. FrontLine is a community-based AIDS service organization that was established in 2015, and we provide non-medical case management services through a peer program, through a peer program that we have that targets individuals living with HIV who are incarcerated in state and parish facilities who are 180 days of release. And our peer program case manager, he assists clients in accessing vital care and treatment. And we also provide education to our clients about HIV transmission. So we do a lot of health education and risk reduction. And then we provide information about mental health and psychosocial support services. And we do these in one-on-one or in large or small group settings. And we also host legal clinics that focus on HIV and AIDS related legal issues. And then we meet individually with people who have more questions. What I do for self-care. One of the things that I've done for myself is I said that I purchased a new bike. I call it my COVID-19 gift to myself. And I take that bike and I ride throughout New Orleans. And one of my favorite spots is to go to the Mississippi River and to sit by the water and to talk to the ancestors and to go to the city park and listen to the water and just appreciate the flowers that they have out there. I also love spending time with my partner and her family, and that just really lowers my anxiety and gives me a sense of calm and of peace.
Yes. Thank you for that, Penny. Thank you.
Mm-hmm.
Yes. And last but not least, we have Mr. Tariq Daniels. And if you could introduce yourself, tell us about who you are, where you're from, your organization and the role you play in the organization, as well as what you're doing for self-care during these times.
Thank you for having me today. My name is Tariq Daniels. My pronouns is he, him. I am the founder and executive director of Whatsinthemirror, as well as the practice administrator for the Center Health Empowerment here in Austin, Texas. Whatsinthemirror is a social movement, a nonprofit organization that provides suicide prevention and mental health awareness to communities of color, with a focus on women, children, and the LGBTQIA community. We have a few initiatives. One of our big initiatives right now is the Our Heals Project, which does work around the intersection of mental health and persons living with HIV. We also have our Connected Care Initiative, which provides free mental health services to people living with HIV and the LGBTQIA community at large. What I do for self-care, I'm a self-identified Afro-queer artist. So I like to write, I like to read, I really want to capture the moment that we're going through in the world right now. So artistry has been really a big part of my self-care, so I can like let some of it out, but also be able to capture what's going on in my feelings and, you know, the ways of the world. So that's kind of what I do for self-care right now.
Good, good. Thank you all. Thank you for your introductions. I just want to introduce again our session today, the title, Southern Solutions, The Community Knows the Way, a conversation with the Gilead Compass Initiative partners. Tell you a little bit more about the Gilead Compass Initiative. The Gilead Compass Initiative has 3 goals. The first one is to change public perception of HIV/AIDS in the South. The second is to improve access to and quality of healthcare services for people living with HIV and AIDS in the South. And then third, to increase local leadership and advocacy in the Southern US. And so with that, you've heard these beautiful introductions. So now you know why this panel represents some of my sheroes and heroes doing work throughout the Southern US to address and to really end the epidemic, the HIV epidemic in the Southern US. So if you're joining us on Facebook Live, if you're joining us on YouTube, we want to invite you as well into this conversation. So at any time you have questions for us, feel free, if there's for chat, to put them in the chat, and we will be able to address your questions throughout our session. And again, today is about Southern Solutions. Yesterday was Southern HIV/AIDS Awareness Day, the second annual, where we're bringing attention to HIV and AIDS in the Southern US, attention and awareness. And so today, the first panel for the day, we're really focusing on the solutions. And this amazing panel is here to offer some solutions to you. So again, if you want to join in on the conversations, to ask questions about the work that they're doing, to figure out how you can replicate, duplicate, share ideas with the panelists, please use this as a networking opportunity as well. So I wanted to get into the first question that I have for the panel. We're talking about solutions and what is possible to end the HIV epidemic in the Southern US. So in exploring what is possible in our efforts to end the epidemic, there seems to be, we think about so many challenges seem out of reach, things that, you know, really don't seem achievable for us, but we know what is possible. And so I want to ask you, what is in our reach? What can we do? Specifically related to the programs, the projects, the initiatives that you are working on in your community to really address and end the epidemic. And so I'll start with Linda. You're on mute, Linda.
That's a great question. The focus of our work with the Compass Initiative is stigma, in particular internalized stigma. And as we're all going through, you know, a pretty unprecedented time right now, I think more and more about how we even pursue the possible. And I think what's possible right now is collaboration like never before. Engage in all communities, all facets of government, community-based organizations, healthcare providers, people living with HIV, educators. You know, COVID has really, really magnified health disparities and the lack of equity and access in healthcare, even how, you know, people have been treated in doing so. So health disparities we know aren't new, but now I think is a great opportunity to bridge that gap. And that has to be a part of the ending the epidemic conversation. That's something that we need to talk about and need to really be very intentional about talking about stigma, lack of access, and all of the other social determinants of health that prevent people from getting the care they need, and that's going to help us to end the epidemic.
Thank you, Linda. And Marco, would you like to answer the question? Just tell us a little bit about what is possible, what is in reach, particularly in your communities and the work that you're doing with folks in your community to address the epidemic in the South and to really end it.
So as most folks know, Florida and Orlando is the epicenter, not only of the HIV epidemic, but also the COVID epidemic in the world now. And so those correlations aren't unique or disparate. They're connected. Because as we're looking into doing community needs assessments in our community related to COVID-19 and its impact on our communities, and particularly the LGBTQ community and communities of color, what we have found is over and over these themes around housing instability, the themes around food insecurity, and the themes around access to health care, in particular HIV care and trans-affirming care. And these are factors, these are deeply rooted disparities that exacerbate the epidemic and in all forms of health disparities. And in our community, that definitely includes the HIV epidemic. And so considering this, one of the strategies that Contigo really instilled in itself from the very beginning when it came to the Pulse tragedy, one of the largest lessons we learned is that the deeply rooted disparities that were already there prior to Pulse were exacerbated by the tragedy, and every single crisis that has occurred since then, from Hurricane Maria and the tens of thousands of Puerto Rican evacuees that have come to and resettled in the Central Florida region, who were working multiple low-wage jobs. In this region, we're one of the regions with the lowest-paying jobs in the country, due to corporations and hospitality. The main drivers of our economy, they don't provide meaningful living wages to folks, and all of these factors combine to create the reason why new HIV transmissions here in our region and the epidemic is becoming far worse. And so from that perspective, from what we learned from addressing all of these tragedies, is that we have to acknowledge that the South is at the epicenter of gun violence, climate disasters, and the resurgence of white supremacy. The South has always been at the epicenter. And people of color, LGBTQ plus people, particularly trans women of color, and folks living in poverty are the ones who are most impacted and at risk when it comes to these issues. And when we're thinking about what we can do moving forward, we have to acknowledge the fact that we are already doing this work. We have been doing this work. The South has been at the forefront of doing this work. And when we think about the concept and philosophy of mutual aid in addressing the COVID-19 pandemic, local communities have come together in ways that we have always come together during moments of crisis. We have leaned on each other. We have used the limited resources that are available to us and have stretched them as far as they can go to support one another. And on a local level, on a hyper local level, there's been mutual aid networks that have been formed, that have been addressing food insecurity, that have been linking people to care when it comes to housing, their health care, and just providing them with basic support in terms for them to be able to meet to pay their cell phone bill, so they can stay connected to loved ones, for them to buy their groceries, for them to be able to cover their rent, basic things. And this is the time where we can really use that infrastructure, this new infrastructure, this mutual aid, all of these mutual aid networks across the South, to really leverage that and create and build power led by and for those who are most marginalized. Because what we know to be true is that in this moment of crisis across our country, the corporations and large Large entities from the far right, the 1%, are consolidating power, and in particular, economic power. And on the local level, we are doing everything possible to consolidate our power to meet the local needs, but we haven't been able to do it on a region-wide level. And that's the key. For us to be able to come together and create strategies between communities across the South, and all the lessons that we are learning on how to meet these urgent needs, and then apply them to the HIV epidemic, and apply them to all across all of our movements for justice.
Yes, Marco, you just hit the nail on the head right there. And really why we're here today talking about Southern solutions, and knowing that the community knows the way. The community can come together and organize to address the community's needs. And what I really heard between you and Linda are a couple of themes around really addressing those social determinants of health in terms of employment, and also addressing health disparities, the disproportionate impact of HIV on communities of color, and particularly communities throughout the South. But, again, the beauty of what I heard from the two of you so far is the community coming together, organizing and sharing solutions across communities to really address the epidemic and to be supportive of each other, and not just HIV, but again, some of these other things that are impacting communities. So thank you for that. And so now I'd like to go to Tarik and ask Tarik, what are some of the solutions, the possible the things that are in reach that you are doing in your community to end the epidemic in the Southern U.S.?
Yes, I definitely want to piggyback on Marco and Penny. Like, they definitely laid out, most of the things that we need to do. And just to kind of expand on stigma, in the work that I do here in Austin, Texas, and with my organization, we really focus on mental health and HIV stigma, right? Really getting to the visibility of persons living with HIV. And what does that look like? What is the voice of the community that we are doing the work for? And so when we focus on art, with our Hills Festival and everything, we want people living with HIV at the table. We want visibility around these people that as doing the work, but also address Marco when he was talking about the crisis, right? The things that we're going through, and mental health. What is our mental health response? And not just the idea of having conversations around it. Where are these services for people who are going through crisis, who are going through trauma? We can talk about HIV prevention, which is very important, but until we get visibility around HIV and mental health stigma, we will just continue to be in a cycle, because it's not just preventing people, it is getting rid of the shame that people who are already living with HIV have from others, and also the shame around what HIV is, and also mental health that causes those traumas. Mm-hmm. So I think that intersection of mental health and HIV is not that far from each other. It goes hand in hand, and it actually goes hand in hand with all the other, social economic disparities that the other two spoke before me. And, working with other organizations, right? Not just organizations that's just doing HIV prevention work. When we talk about organizations that are doing work around Black Lives Matter right now, right? Why isn't HIV prevention or persons living with HIV and the trauma around HIV stigma not at the forefront of any Black movement in the South? Those are the questions that I ask all the, racial justice organizations in my community. Why aren't we talking about HIV and the stigma around it? And so I think once we continue to cross the line with people who's doing the work, and when we actually identify the stigma and really change the visibility of what HIV means to people in the South, I think we will be going in the right direction around healthy solutions for persons living with HIV.
Thank you. A phenomenal response, Tarik. And I really think that, what 2020 has brought to attention, brought to the forefront, is the importance of mental health. Taking care of your mental health during these times and certainly recognize the intersections between HIV and mental health, and how important the work you're doing in Austin in bringing those intersections together, and especially around arts as a healing tool and mechanism for people during these times. And, recognizing again the stigma that exists, and, addressing it head on in the South, and being able to talk about stigma and being able to talk about mental health are certainly another reason why I admire all of you and the work that you're doing. It's certainly important to bring those issues to the forefront and not just talk about them, but do something about them as well. And so again, I'd like to invite those who are watching, who are listening to us around the country, in the South, if you have questions that you want to ask us, we want you to be a part of this conversation as well. So please feel free to send us your questions and ask us anything around solutions, Southern solutions to end the HIV epidemic in the Southern US. And so now I want to turn to Penny. Penny, and I want to ask you the same thing. What is in reach to end the epidemic? What is possible in the Southern US, particularly around the work that you're doing with formerly incarcerated persons? You're on mute. You're on mute.
The challenge for us is we are able to case manage folks when they are in the parish jails and when they are in the DOC facilities. The ball gets dropped when they are released and they disappear. And so one of the things that we are trying at FrontLine, what we are trying to do is we are trying to establish more opportunities to collaborate with jail and prison workers and personnel throughout the state to assist us in expanding our reach, first of all, into more prisons and jails and halfway houses, but to also find a way of how we can link and connect those clients once they are released, because quite often they are released in the middle of the night and we lose them. We lose them to the homeless crisis. We lose them back into those communities that ended up getting them in those detention facilities. So what we're trying to do is we are trying to collaborate, establish relationships, and maintain those ties and levels of open communication with folks who have direct access to folks who are living with HIV in those detention centers. And what we want to be able to do is we want to be able to establish some kind of handoff process where we can assist with transportation efforts to get them to where they need to be once they're released. We get a phone call, or we get an email, or we get a text alert or something like that to let us know that one of our clients is being released, and and then we're able to pick them up and transport them, because our goal is, as we are case managing them in the facilities, we want to be able to link and connect them to healthcare, to housing, to financial assistance, that mental health and substance use treatment that we know so many of our patients and our clients in the South need, as well as legal services. And so that's one of the things that we know is possible. We're eating that elephant one bite at a time. But the crucial thing is to be able to establish those trustworthy relationships with those folks who have access to our clients.
Phenomenal work. I can imagine being released and returning into a community and trying to get acclimated to the community, not only trying to reconnect with folks that you may have been away from for years, but in addition to that, searching for employment and many of the challenges that occur with, establishing a residence or getting an ID, or and then thinking about your health care, as well as trying to find a place to lay your head at night. So again, the work that you're doing is so important, so meaningful, so powerful in reconnecting and making sure that folks who are recently released, who are coming back and into communities, that they are integrated into their community, but also, the importance of their healthcare and not forgetting. It's so easy to put that on the back burner, and even the stigma related to that, in terms of taking your medications and not wanting people to see or know or hear, about your status and the stigma around that. But, the work that you're doing is just so phenomenal to help people acclimate and be back into communities and be supportive as they transition and really gain their life back.
Yes.
Mm-hmm. And Halenia, can you talk to us about what is possible? What is in reach to end the HIV epidemic for Black trans women, for Black trans men, for people throughout the South, and particularly in Memphis, Tennessee, where you live and the work that you're doing?
Well, everything really does kind of piggyback off of what everyone has said. The focus really does have to be geared towards or shifted towards focusing on everybody's mental health or mental clarity, mental sanity. Where are we in our heads? Are we healthy? Are we working towards being healthy? Are we addressing, uncovering, and working through trauma? Because if we aren't, none of the services that we have are really going to be utilized to their capacities. We can be awarded 1,000 grants. They can do 1,000 different things. And if we aren't dealing with people who are working towards becoming mentally healthy, because you don't have to be mentally healthy, but you need to be working towards getting there, these services aren't going to mean a thing. And I say that because of a conversation I had with my executive director in saying that we need to not only focus on the mental stability and health of our clients, but we also have to do that same thing for our people within our house that serve our clients. If they aren't mentally healthy, they can't help people become mentally healthy. It is in living in a global pandemic as a Black gay person, a Hispanic gay person, LGBTQ, queer, trans, anything that is underserved, that is marginalized, that is overlooked, that is overseen, there is going to be some type of mental help that needs to happen, and we need that on so many different levels. Are not okay. And we might feel like we are because we tell ourselves we are to be able to do this work, but we aren't. And so for me, I like to start in-house. So I want all of our staff to be able to receive some type of psychosocial services because we are working with people who need them, and we're also living through the global pandemic with them as well. Then from there, I think there should be more grants available to focus in and around these services. We need the funding for it. We have to pay someone to do the work who can do the work, who's probably not going to do it for free. So we need more grants available. And then when we have those grants available, we need to really put those grants into places and communities, into areas where they're going to hit the most hit by this situation that we're in, because generational trauma is real, and it's really real with our community, and it plays a big factor. Our community is hit so hard by poverty, by HIV, by this, that, and the other. So I think that we need to regroup, and we need to write more grants that focus in and around those areas where those people need the most help, and that's our mental stability and our mental health.
Thank you, Halenia. So important. I think, the one thing that the focus areas of the Gilead Compass Initiative, one of them that is so important to us is mental health and trauma-informed care. And so, it really resonates that, one of the focus areas, one of the pillars addresses that area and how important it is for communities throughout the South, for people living with HIV, impacted by HIV, to address mental health and trauma-informed care. Penny, I want to come back to you because we have several comments and questions from people who are with us at home who are asking about housing, the importance of housing as healthcare, and the difficulty in finding housing and the barrier for newly released persons who are coming back to communities. And then I'd like Marco to address that as well for folks who are undocumented in communities throughout the South, and the challenges around housing and the importance of that for their healthcare.
Housing is healthcare, and that is certainly one of the challenges that we experience in New Orleans and throughout Louisiana. But there are waiting lists that we add names to those waiting lists, and folks will wait patiently. Luckily, many folks have relatives that they can stay with, but that's not always the best solution. And some of the housing here is not always in the best condition as well. There are, especially when you have folks who are re-entering back into their communities, and they were incarcerated because of a substance use issue. Sometimes some of the housing places them back into those types of environments, and it makes it very challenging for them to stay adherent to their medication. It makes them very challenging for them to stay out of that system. And the solution is that there needs to be more housing set aside for reentry population. And I don't necessarily know how the city can accomplish that specifically for folks who are reentering, but it's something that is greatly needed. There's also housing for residential housing for folks who have substance use issues, who need that type of care. Quite often, again, there are waiting lists for those types of for situations and living environments. We need more of those as well. Louisiana is a state. New Orleans is a city that cut back on residential housing for folks with substance use and mental health issues. And unfortunately, a lot of the folks that we see living under the bridges and stuff like that are folks that have been turned away from those facilities, from those housing from those housing needs.
Yeah, it just dawned on me that how important and rich this conversation is. And I just want to take a moment. If you have your phones in your hand, if you're viewing us from Facebook, if you can share this platform, share our conversation so that people can join us and hear what you're saying about the importance of housing in communities throughout the South and what that means for healthcare. And then I'd like Marco to also address this question around housing and healthcare for communities who are undocumented.
Yeah, so in terms of housing, the reality of the challenges here in Florida are desperate. Florida has never really recovered from the housing crisis that was caused by the recession. And it's only been exacerbated by state policies that have reduced options for individuals who are low income or living below the poverty line. And for undocumented communities, even in terms of the COVID crisis, undocumented communities are wholesale being excluded. Even though undocumented communities are literally the base the foundation that we stand on when it comes to essential workers that are from the agricultural sector to the service sector, that are literally the engine that are driving the recovery of our nation forward as essential workers. They are wholesale excluded from any portion of being able to sustain themselves or access that recovery. So it's essential but excluded is the narrative that undocumented communities have been living through, not only during this administration, but in turn for decades, based off of the broken immigration laws of this country. And so it leaves undocumented communities in a super vulnerable place when it comes to exploitation. And here in Florida, there's very little resources being made accessible when it comes to housing for undocumented individuals. And I speak from a personal place. I myself grew up here in Orlando as an undocumented person who experienced homelessness as a queer youth for a number of years. And I can tell you that shelters weren't a safe place for me. I did not have ID documents. Many times I couldn't access shelter from the very beginning. And even going to a shelter, immigration and customs enforcement have been targeting shelters to try to in raids to try to entrap individuals who are undocumented. So it's a very unsafe environment for undocumented people. And when it comes to the healthcare, that's the same narrative. That's the same story. Undocumented people can't access the Affordable Care Act. The undocumented individuals can't seek support from government-funded nonprofits many times. And so there has to be strategies. The whole concept of mutual aid and what we're doing here locally. Our Central Florida LGBTQ Mutual Aid Network that Contigo facilitated the development and launch of, but is a collaboration of a number of organizations, many organizations that are actually cut off from mainstream philanthropy, that Contigo, through the support of Gilead, is able to support, are at the forefront of being the individuals who are really addressing all of these needs for the undocumented communities that government, local, regional, local, states, and federal government are failing at this moment, either through direct assistance, linkages to care, or deeper case management for us to find solutions to the challenges to the realities that these are the communities are being left behind in recovery.
I want to thank you for sharing.
Shanell, I'd like to say one more thing as well. During the COVID, when COVID was really bad here in New Orleans, the city was able to obtain funding to take the homeless population off the streets and house them temporarily in hotels. Mm-hmm. Unfortunately, when the numbers began to drop and the federal funds ran out, so did those housing vouchers. Mm-hmm. And so now we have folks that have been turned away from that stable housing and have now been put back onto the streets or into whatever other unsuitable housing situations.
I wanted to turn to Linda Dixon and provide just a unique perspective around housing and the barriers of housing, particularly in Mississippi and in rural Mississippi, and what that looks like and what are some of the solutions. What are people doing to address? And I think I remember seeing something on Facebook around you posting about housing and potential for evictions that were coming up and what those intersections look like around healthcare and HIV. But if you can share your thoughts and what's happening in rural communities around housing.
Sure. Thank you. And I see that's a question from the Facebook. So thank you so much for asking such a great question. Mississippi, 54% of Mississippians live in rural parts of the state. We have 82 counties. So that's a lot of people living all over the state. And when you look at communities, rural communities like the Delta, for example, the Mississippi Delta, you have high rates of poverty. You have a lack of access to a lot of different things. As it pertains to HIV, you don't have infectious disease doctors there. You have one or two maybe in the Mississippi Delta. So accessing healthcare in that regard is very limited, although we do have some good healthcare facilities in the Delta. Housing, of course, is an issue. Yes, we did address the eviction issues, the Mississippi Center for Justice, during the pandemic. People were being evicted for a lot of different reasons. And I think, Penny, you said it best, housing is healthcare. So without stable housing, without a stable place to live, it's hard to be, compliant to medication, your medication regime. It's just hard to, HIV is not going to be your primary concern. Your primary concern is going to be focusing on a place to live. So, housing is huge. There are a lot of great organizations in the Delta that are doing work, with people living with HIV, testing and things of that nature. But we also have to look at some of the barriers. One of those major barriers is transportation. There's a huge lack of access. If you don't have a public transportation system and you're living in a county where you may have to drive 2 or 3 counties over to access services, that's a problem. And if you don't have a car, that's a problem. So you're having to pay someone possibly to take you to be able to get services in another county. So I think, really putting a lot of focus and emphasis on the structural issues and the systemic issues in the Delta and in other places in rural areas, I think is huge. And this is a great opportunity, again, to address this in the Ending the Epidemic solutions. This is where we need to be looking at this and the systemic issues with health disparities and racial inequities in accessing all of these services.
Linda, what you really done is lead into the next question that I had. And so I want you to be the first to really answer that. But if you could have a one-on-one with the current and future public health officials, government officials, what would you tell them in terms of a policy perspective is needed to end the epidemic in the southern US? I think both you, Penny, and Marco really talked about some things that are important. But if you had that one-on-one and that 15-minute elevator talk with them, what would it be? What would you tell them is needed to address and end the HIV epidemic in the South?
First of all, I would tell our elected officials and candidates to listen to their constituents, to have town hall meetings or listening sessions, to really talk to people and engage people living with HIV, people who serve people living with HIV, to make an assessment of what their community needs and not what they think their community needs. I think that's huge. I would also like to see more done on with the ending the epidemic, that our public officials really get engaged in that. And now is the time to do it. Won't you ask, what's the second part of that question? I'm sorry.
Yeah, what's needed in terms of policy to end the epidemic in the US and public health officials as well?
Okay, so in the state of Mississippi, and I know it's in other states across the country, in particular in the South, we have laws on the books that criminalize HIV. I think we need to look there. We need to eliminate and reform policy around HIV, decriminalize HIV. That's a way that we can show people living with HIV and others that our elected officials and state officials really get it, that they understand by eliminating this and not criminalizing a disease.
And then for Halenia, as a Black trans woman, living in Memphis, what would be important for leaders to hear from you about what is needed to end the epidemic in the southern US?
it's off. Okay, can you hear me
Yes.
now? Okay. I think it's important for us to sometimes have people ask themselves, what is your reasoning for what you do? Are you running in these positions because you're a humanitarian? Because if you are in any of these seats, you're supposed to be somewhat of a humanitarian. You're running because you want the best laws to be passed. You want the best medical care to be out for humanity, for us. So are you running for a popularity contest? Are you running because you care? What is your purpose in holding office, holding a seat on a board, holding something? You have to ask yourself that. And then you have to answer that question. And it depending on how you answer that question, depends on what direction we're going to go in with legislation, with laws, and with our communities, and with everything else. I don't think that they stop and think, I'm not running for me, I'm running for them. I'm running for the city. The mayor is for the city. The governor is for the people. We're here to help each other make sure that we're making the right decisions and making the right laws that work for our people. And too many times we aren't doing that. And I think that we need to ask them more often, why are you running? What are you here for? What is your purpose? And in asking them, hold them accountable as they aren't doing it. We have to make sure that we're voting, that we're making our brothers and sisters votes, that we're placing importance on voting. In each an individual election, just not the big one, but each an individual running up to that big time. We need to make noise. We have to continue to protest. We can't die down. We can't speak today and be loud today, and then a couple of weeks later, a music video came out, so we forgot about it. We have to stay on it and be consistent. And be consistent in reminding people, and be consistent in asking those questions. Why are you here? Why are you in this position? If you aren't asking us what we need, if you aren't giving us what we need, if you don't care what we need, that's what I think has to happen. And it has to happen from the bottom up. And we have to be strong and be consistent and just keep hammering and hammering and hammering until they get tired of us hammering. And then they're going to want some peace, because we don't have peace. We can't give them peace.
I have a question for you as well, Halenia. I wanted to ask you, what is needed to keep Black trans women safe in communities throughout the South? That's something that, you're my sister, and I love you dearly. And something that, I often think about and struggle with every time we hear about the death of another Black trans woman or trans woman of color, frankly. And so, as I think, what are solutions? What do leaders need to do as allies to support and help keep Black, brown, trans women of color safe in their communities?
I can't tell you what leaders need to do, but I know us as Black people and people of color, we have to start loving each other a little bit more. It is not fair to Black trans women that we don't have anybody to protect us. We don't have Black trans, we don't have Black men, we don't have Black gay men, we don't have anybody. Our lives are valuable. We have something to offer. We don't have the police. We don't have anybody. So we're going to have to start somewhere, and that's going to be at home. I need for y'all to start loving your Black trans children. You can't put them out because they don't have anybody else. They don't. They don't have Black men. They don't have the policemen. They don't have, a lot of times, Black women. I've been blessed to be in a field where I work with educated women, and I work with strong Black women who are confident and who've had a chance to meet me and know that I have an opinion and I have a heart and I have a goal to help others. And so they've been able to fall in love with me, able to work with their demons and figure out their reasons for not wanting to like a person like me, and learn to love a person like me instead of like a person like me. I've had that. We all don't. We all do not have that. And all I can say is that it needs to start at home. We have to take care of our own first, because you can't expect anybody else to take care of someone if you don't want to take care of them. But these are someone's children, it's someone's daughters, it's someone's sons, it's a soul. Black trans women are souls, people. They are lights. And if you are human, you cannot neglect that, and you cannot neglect them. They deserve to be protected as well. I would just say start at home, Shanell. Start at home. Love your offspring regardless of what it came out to be. Because if no one else is going to be there to protect them, you have to protect your child. Protect yours first.
Whew, thank you. I also wanted to ask you about the importance of cisgender women and trans women supporting each other, and how our oppressions are so linked to each other. And for me to be free means for you to be free, right? As a trans woman. And so you often hear and see, these the conflicts or the lack of acceptance among cisgender women and trans women. And I want just to hear from you to speak about the importance, what that acceptance means and how powerful that can be.
How much further we can move forward together than separately. That's what that could be. The strength within trans women, and the strength that you would have if trans women and cis women could understand that they have the same fight. You have on the totem pole Black men, Black women, Black trans women, because none of the above are here for them, as none of the above are here for them and them. So instead of us wanting to feel that one of us is better than the other, we need to all realize that we all in that hole together. We all are seen to get paid that 35 to 45 to, once you reach the fact that you want to actually be trans, that 50 to no sense because you didn't get the job list, okay? So let's just be real about it. When we understand that our fight is not over if a man looks at a trans woman or a cis woman, because he don't look at both. If it's appealing to him, he's going to look at both. If we understand that it's not one of us wanting to be the other, but we're wanting to be who we feel comfortable as. And that's the cis woman and trans woman. And as soon as we realize that we are stronger together instead of fighting each other, and we get out of that slave mentality that we have been programmed to be in, where one is better than the other, or you're gonna go further by leaving this person behind. You're not. We're not. And that's what we speak on, that generational trauma that's been passed down from our great grandparents that we have not uncovered or addressed, and we're wanting to push forward. We have to stop leaving each other. We have to take each other with us. We have to stop feeling that you don't want to tell someone how you got there because you worked so hard to get there. Make someone's time easier and watch you be blessed. I promise you will. Stop thinking, well, I had such a hard time, they need to have a hard time. Think, no, I want to make someone's time easier. That's how I think in life. When I know how to do something, I'm running to show you what I know. And I'm realizing that there aren't that many people like that. And that is heartbreaking. And that's why you see me in tears when you ask that question, because I was just having a conversation with someone yesterday about who do we have? Who do we have to protect us? And who do we have to help us? Each other. That's it. Each other. We have to do better, people. Light, brown, dark, small, big, rich, poor. We are all we have, y'all. Ask yourself every day, what are you doing to help someone else? We only wake up and think about our goals, our dreams, our aspirations, what we're going to do to make it to this. What are you really, really doing to make sure someone else gets to be where you are? It is so important to ask yourself that every day. And that's what I do with my other trans girls and with cisgender, with women, period. I mean, like, not even just trans women. I just always think that, you know, would my mom be proud of me if I'm going in this direction, if I'm treating this person this way, or that's it. We have to be there for each other, and it's cis women, as trans women, we are more alike than we are different, and we don't realize it because we've been programmed not to see.
I think our conversation has evolved and has moved into a space that is sacred, that's important, that is timely. And, I hear you saying solutions are coming together as one to love, to address these challenges head on. And so, I wanted to turn to Tarik and ask Tarik, in terms of solutions, in being sure to include the T in LGBTQIA+, and how important that is, and what are some solutions and techniques you found in Austin and the work you're doing around mental health and the intersections with HIV and the arts community to make sure that it's an inclusive environment and culture.
So I definitely want to acknowledge Halenia and definitely say that, Black Trans Lives Matter is more than just a hashtag, guys. It is it's a mandate that we must protect our trans women of color, period. For me, it's easier, right? Because transness is everything that I know, trans women in my life, trans men in my life. And I believe that we have to be very intentional around inclusion. If I'm having an event, I'm saying trans included. I don't, make our community have to guess if they're invited. The invitation is open, it is outward. If I'm sitting on a commission, where's our trans inclusion? Where is our trans visibility? What are we doing to make sure that our whole community is represented? Whether it's trans, whether it's women of color, trans men of color, whether it's our intersex community, we have a whole, intersex community of color that, that still feels the stigma and the, exclusion in a lot of the work that we do in our community. And so this intentionality. You have to say what it is that you're trying to do. We can't assume that people feel comfortable, that people know that they're invited. You have to create that brave space. You have to, make sure they have a seat at the table and be unapologetic about it. And I think if we all be a little bit more brave around that, acknowledging our own issues that we have within ourselves, why aren't you doing what's needed to be done to make sure that we have full representation of our community here? And so many people are afraid of that, right, in general, because they don't want to look at themselves as the bad guy. But we are past that, right? That's not an option. We can't, self-loathe, and, we have to be intentional about the work. And so I just make sure that I do my best, and make sure that anything that, even with the Art Hills Festival, I say transness, I say inclusion of everyone. I make it very deliberate, very intentional. I don't like organizations that consider themselves queer and don't have representation. I'm at the table saying that I'm not comfortable with this. As a cis queer man, this is not comfortable for me. And I feel like if we all just take that responsibility, diversity and inclusion would come a little easier, because right now we're in a place that we hear about it. Everybody's talking about it. We know what's going on, but we're afraid in a lot of ways to look inward. because we don't want to be that person. But like she was saying, it's generational trauma. It is generational ignorance. And so we have to do that work and be a little bit more intentional and direct about inclusion and diversity.
Thank you for that, Tariq. One of the other things that, again, the Gilead Compass Initiative has provided funds to community partners like all of you to address these issues of stigma and mental health, trauma-informed care, building organizational capacity to make sure that it's inclusive. And I wanted to turn to Marco now at this time and ask, Marco, how has the Gilead Compass Initiative funds allowed the Contigo Fund to create a inclusive environment? And then as well, I have a follow-up question about your unique grant-making opportunity, but we'll get to that next. But first, can you talk about how the funds through the Gilead Compass Initiative has allowed for an inclusive community and work in Orlando?
Absolutely. So the story, the support of Gilead has really supported Contigo's ability to do so many things here in the local community ever since the Pulse tragedy struck, forever changed and transformed our community. I always start off with my story of self because I always think it's really important to own that. I grew up and out of the undocumented youth movement, and that journey, that's the community that instilled the skills and leadership in me for me to be in the place I am today. Contigo is now the first and only LGBTQ Latinx fund in the United States. And we are working with other Southern funds, progressive funds, social justice funds across the South to instill some of the model of what we do at Contigo, which is honoring the self-determination of the individuals who are most impacted. The three guiding values of Contigo are intersectionality, recognizing that LGBTQ people have a critical role across all of our movements for justice, self-determination of those who are most marginalized, nothing with us without us, and lastly, collective liberation, understanding that until everyone is free, no one is free, and those are the guiding values that we launched with when we were first born out of the Pulse tragedy. And our work is centered around breaking down silos. This why I mentioned the mutual aid networks that have risen out of the COVID epidemic so much is because in so many ways it's such a beautiful example of how we have broken down silos between organizations, between leaders, between agencies, between government, philanthropy, and so forth, for people to come together to address issues that they could not address by themselves, and how important it is to be in solidarity with one another. Another thing is that of our work is recognizing the need to decolonize philanthropy. Philanthropy isn't something that was built for us. It isn't, much of mainstream philanthropy isn't accessible to grassroots organizations, to movement building, community building organizations, and organizations that are led by and for LGBTQ and communities of color. And so having Contigo or intermediaries that are led by and for LGBTQ communities of color is extraordinarily important, because we believe that having those type of vehicles, putting the resources into the direct hands of individuals who know their communities best, are the ones who can create the best solutions moving forward around the problems and challenges we are currently facing. And it's about trust-based philanthropy. Trusting people, trusting that those individuals know once you put the resources in their hands, trusting that that is what needed to be done, and that they know how to best use those resources, and trust them throughout every step of the process, meaning low barrier, no high barrier ways of reporting, high barrier ways of monitoring or stepping in to the work, but allowing them to simply do the work, providing them a seat at the table and giving them decision-making power. And through that work, since the Pulse tragedy, there was not even one organization that was led by and for LGBTQ communities of color here in Orlando. Not even one. Since then, there's over 15 organizations that are led by and for LGBTQ Latinx communities, Black communities, trans communities, API communities, Muslim communities, undocumented communities, and so forth. And so that it was critical for us to be able to then build that infrastructure. And now we're investing more deeply in the movement building and community building that needs to happen for them to get a seat at the table in other sectors, from government advisories, from the on board of directors of nonprofits and agencies, for them to have their voice honored and their self-determination honored. And I would just lift up a couple of organizations that are really at the forefront of doing so much of that work. Latinx, one of the organizations that we, through Gilead's funding, through our re-granting program, we were able to also fund. It was an organization that didn't exist prior to the Pulse tragedy. That was a collection of survivors and individuals who are disproportionately impacted by the Pulse tragedy, and now is one of the grassroots organizations that are led by and for LGBTQ Latinx youth in our region. One of the largest, it has grown into one of the largest ones, building community and leadership for those individuals. And they have been a critical partner in the Center for LGBTQ Mutual Aid Network, which has led community needs assessments and led linkages to individuals to actually provide them support through this urgent moment. The Bros in Combo Initiative is another organization I would want to lift up. It is a peer-to-peer support network for Black men, gay, bi, trans men affected by HIV, who are doing extraordinary work in our community. And just recently, a new partnership between the Farm Workers Association of Florida that represents the largest community of farm workers, migrant workers, undocumented individuals in our region, and 26 Health, which is a HIV service organization in a comprehensive health organization that also provides mental health counseling and primary care, who have formed a partnership to now bring out all those services to the rural community here in our region, who has historically been underserved. All of that work has been made possible because Contigo is led by and for communities who are most impacted. We're led by a 14-member community board who is representative of the full diversity of our LGBTQ plus community, Black, Latinx, undocumented, rural, farm working communities, communities of faith, are all represented in our community board, and they're the decision makers of where the strategic directions, where the solutions are, and they decide where the money goes. And I think that's really important. Getting decolonizing philanthropy is about getting the resources closer to, and the decision-making process closer to the hands of those who are most directly impacted, and that's how we function. And that's why we've seen so much progress in terms of us being able to build up leadership here in our local community.
Thank you for that. You know, one of the, again, just the unique things about Contigo Fund is, you know, not only do you work with communities for service provision, but, you know, also a grant maker to organizations. and just the beauty and the uniqueness in that grant making structure. And that's something, you never know how you impact people when you meet them. And it's been several years when I heard you present in Louisville, Kentucky, and you're on stage talking about this unique grant making model, this unique and re-envisioning what philanthropy looked like. I'm old school, so I keep thinking FUBU when you talk about for you, by you. And I keep thinking about that and how the importance of allowing people who are from community to make decisions for their community and be able to have those funds in hand to then address community. And so, Penny, we haven't heard from you in just a little bit, and I appreciate you, listening in during this time, and wanted to ask you about the importance of that, of work being led by people who are living with HIV, work being led by people who are newly released from incarceration and integrating and being back in communities, and what are the benefits? What does FUBU bring to the table when given the seat and the microphone?
The benefit that FrontLine has is when we are going into the jail and prison settings, we are a small staff. We have we have 6 on our team, and 4 of the 6 are living with 3 of the 6 are living with HIV. 4 of the 6 are queer people of color. And so we bring that into our situations when we are in the jail and prison settings. When we are facilitating our workshops, we can tell the residents that we are people living with HIV, that we are people who understand that struggle. We are people that have to take medication, that choose to take medication every day, that we are people who choose to stay connected in care. And that is definitely something that seems to bond us, as it were, bond us to the clients that we talk to. When they realize that they're talking to somebody who can relate to their experience, we see their guards come down. We see them more willing to talk to us about what their struggles are, why they are choosing to not stay in care. And then we can share, I can personally share an experience with them about what my physical challenges were when I chose to step away from care for 3 years. And they get that. And when I tell them that I'm a woman living with HIV for 34 years, they get the deer in the headlights look, and they say, wow, you don't look like it. So again, it's back to that stigma that HIV and AIDS has a look to it. But all of those things make us relatable to a population that is marginalized and that have really been disenfranchised from the healthcare and social services system. And so when we share that with them, we are able to make some headway. And then when we continue going in and establishing that relationship, we leave them our business card. And when they are released, they call us and they say, you remember me? I am the person who. One of the great success stories that I like to share is when we go into, when we've had occasions where we've gone into the women's facility here in the state of Louisiana, and we've conducted our health education risk reduction workshops with groups of women. And then, we're able to talk about U equals U. We're able to talk about PrEP as healthcare. And then there's a sign up list where folks are able to come and talk to us one-on-one. And there's one woman who came to us and she told us that she was a woman living with HIV and how she has been advocating for the other women inside the facility who have yet to find their voice. And basically she said, when I leave this facility, I want to go back to my community as a woman living with HIV and to be able to advocate for other people on the outside who've not found their voice in her community. And sure enough, she continued to keep in touch with us via letters. And we had one other opportunity to chat with her, to see her and to chat with her before the facilities went on COVID lockdown. And she did contact us when she finally did get out. And she said, I'm ready. I'm ready. I am ready to do what I committed to do, because you guys really encouraged me with you not being afraid to share your status, willing to help others who are in our situations. And she said, I'm ready to do that. And we were able to connect her with people in her community, and she's living the life of a recently incarcerated, now released woman living with HIV who's out in the community helping others.
An amazing example, excuse me, of a Southern solution. Excuse me. I'm getting choked up. It's just phenomenal work that the Gilead Compass Initiative has really allowed communities to do in the South to address HIV and to lead to ending the epidemic in the Southern US. We are almost at time. We have just a few more minutes. And so before we go, I wanted to ask Tarik a question. And just, I know who I am in this work, and I know who I'm not, right? I know who I'm not in this work as a Black, cisgender, heterosexual female. And so asking that question, how can people who are not a part of particular communities aid in ending the epidemic and support in addressing needs of communities that they are not representative of?
I mean, simply put, like, love is the emotion and the goal that we must have for each other. I always say spread love, and people get on me all the time, like, you just saying that, you just say that. No, I really believe that. I really believe that if we just love each other foremost, the way that we need to be loved, the way that we desire to be loved, everything will fall in place. And of course, there are actionable items, right? But definitely lead with love, and then just, move from just being an ally, right? You have to do something. You have to see what's wrong and do your part to make it right. It's not enough just to have a queer friend, or, I got a gay person in my family, or I know somebody living with HIV. What are we doing? What are the people who know doing to address these disparities, And so, not to go all into it, I know we short for time. I just really want to spread this idea that if we just really spread love and really show love and really care for people, get back to that humanity, from numbers to the narrative, and I think that that's a great start, followed up by actionable items that we must do.
Thank you. And so before we go, we have, I think, enough time for each person to get about 15 seconds or so. And so I want to turn to Linda real quick and say, what is the Southern solution? What would be your final words for this panel around ending the epidemic and Southern solutions?
First of all, I want to thank you for the invitation to join this panel. And I just want to end by saying we need to move from being more inclusive to all inclusive, and really touch people's hearts, and hopefully people will open up their hearts. I think that's where the solution begins.
And Marco? In just a few seconds, what is the Southern solution? What do you have to offer to those who are still watching us, who stayed with us for an hour and a half during this conversation around the Southern solution to end the epidemic?
Those that are closest to the challenges that we are facing are those that are closest to the solutions. Trust. Trust is the one thing that we need right now, and solidarity. Unite, and we can really figure this out together as long as we're really placing those who are most impacted at the forefront of being the drivers of the solutions.
Thank you. And Helena, your final statement around Southern solutions and what's needed to end the epidemic.
If we just go into everything with good intentions and be intentional in wanting for others what we want for ourselves, I think we're going to do it right.
And then Penny.
That it is okay to think outside the box, that we don't have to do things the way that they've formerly been done. The definition of insanity is, we all know that. And so the beauty of what Gilead has allowed us to do is to think outside the box and to widen our parameters on how to design our programs to meet our clients right where they are.
Beautiful, beautiful. And so, on behalf of Gilead Sciences, the Gilead Compass Initiative, Public Affairs, Corporate Giving at Gilead, we appreciate the partnership. We know that it takes a unique multi-sector partnership to get this work done, especially to end the epidemic and particularly to end the epidemic in the Southern U.S. And so, as we close out, I think we've more than demonstrated that the community knows the way to end the epidemic in the Southern U.S. And so if you want more information about the Gilead Compass Initiative, please go to our website. There's also an interactive map that allows you to find organizations just like the ones that you've heard from today on this panel, to find where they are, to get their contact information that links you to their website if you want to learn more. And so, we are happy and pleased. And I want to thank you from the bottom of my heart. You guys have taken me to places I didn't know I was going to go this morning. So once I fix this eyelash, I'm going to do some self-care and go on a walk and really reflect and think about the beauty and how, I mentioned it in the beginning. And I think if people have stayed with us for this hour and a half, they know why you are my sheroes and heroes who are doing this work in the Southern U.S. to end the HIV/AIDS epidemic. And so, I just want to thank you again from the bottom of my heart for sharing, for being raw, for being real, and really opening your heart and sharing with us the work you're doing through the Gilead Compass Initiative and how it's impacting your communities. And so with that, I just wanted to let folks know, again, today was the second day of the Southern HIV/AIDS Awareness Day. Yesterday, the first day, you heard about why it's important bringing attention to the HIV/AIDS epidemic in the South. And then today was all about solutions. Our panel discussion was about solutions through the Gilead Compass Initiative. And so you'll hear more the rest of today about solutions to end the epidemic in the Southern U.S. And so, at 12 o'clock, you've got about half an hour to get your lunch. And so 12 o'clock Eastern time, right here, same channel, same place, you can join Southern AIDS Coalition with federal partners to discuss the progress on ending the HIV epidemic plan. And so just wanted to let you know it's a full day. And I know I don't want to miss Marvin. I don't want to miss Marvin Anderson's call to action. He's always provided a phenomenal and uplifting call to action for us during the Gilead Compass Initiative convenings that we've held. It's been a powerful moment. And then, today our panel discussion was just quite moving. And so I want to thank you. I want you all to continue to engage in the self-care you're doing, especially after this discussion today that we've had this morning. And so with that, be blessed and thank you and have a safe weekend and look forward to catching up with you later.